Saturday, March 9th at 10 a.m. Eastern, I have a workshop called Dealing with Rage, Your Health, and Yourself. This workshop is not a therapy event. It's just an educational and self-development workshop. But I really encourage you to take what you learn in this workshop and bring it into your therapy sessions. I think that is always really helpful when we have adjunct work in between sessions. And so in this workshop, we're going to go over some realistic anger management strategies, not just take a deep breath, although I'm a big fan of breathing, self-compassion practices, and it comes with a workbook that will help you create your own actionable steps for change. Anger is something that we deal with a lot when it comes to our health, and it's something that no one really talks about. So I'm really excited to be doing this workshop. Again, that's March 9th, 2024 at 10 a.m. Eastern, and the link to sign up is in the show notes. Additionally, if you are a resident of Georgia or Florida, then I have a therapy group that is starting on April 1st, 2024. The workshop that I just mentioned a moment ago, that's for anyone. It's not therapy. But this is a therapy group and is open to residents of the states that I'm licensed in. So this group will be 12 sessions long weekly. They're 90 minutes and they are virtual. They're via video. And it'll be every Tuesday from 3 to 4:30 p.m. starting April 1st. It comes with a digital workbook, and the group format is a little bit of education where I'll be starting each session with an educational component around things like grief and identity work, working through anger, guilt and self-blame, fear of your body. That's a big one that we'll probably talk about a lot. And symptoms like brain fog, physical pain, chronic fatigue, dizziness, all of that. We'll be learning some pain management techniques and skills and practicing those in a way that is genuine and hopefully will stick. Because we can learn a lot of these things and then feel like we know it and then never do it, or just feel like it doesn't work for us. And really, it might be that we didn't have that helping hand, that warmth throughout the learning process. I think that's what happens a lot of the time is we're trying to learn something in our brain. We don't have any support around it. And then we feel like we know it, but it didn't work for us because we didn't really have all of the follow through. And again, that follow through usually only happens when you have really warm, genuine support. So that's what I'm hoping to provide with this group. If you have out-of-network benefits with your insurance, then super bills will be provided. If not, then it's just a private paid group. And I want to offer a couple of bonuses as well. I'm calling them bonuses because if you live in Florida, this might not be feasible, but we're going to do an in-person meetup at the end of each month. And so that'll be 3 meetups in total, but that will be in Atlanta. If you're in Florida and you want to travel up this way, that would be amazing. But just to know that's not a requirement of the group, and it's really just an extra thing that I want to do because I think virtual work is amazing. And sometimes that in-person aspect can really just tie everything together. That will be a bonus. And then another bonus session. And again, I'm calling this a bonus because it's not mandatory and it really depends on if you have someone you would want to bring with you or if they would even agree to attending. But at the end of the program, or maybe 2/3 of the way through, I haven't decided yet, there will be a session, a group session, where your family members can attend the group to learn about how they can better support you in your journey. So that's the group therapy program. And again, I will have a link in the description box below with more information for that. But if you're interested in either of those things, click those links, or you can email me at destiny@destinywinters.com. The Chronic Illness Therapist podcast is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learned here, and please consider leaving a review or sharing this podcast with someone you love. This podcast is meant for educational purposes only. For specific questions related to your unique circumstances, please contact a licensed medical professional in your state of residence. Caylin Broome is a social justice oriented therapist who believes in the inherent dignity and worth of people from all walks of life. She believes many mental health concerns arise because of a lack of social support. Things like systemic racism, sexism, weight stigma, societal misunderstandings of grief, lack of affirming care for LGBTQIA plus individuals, and unequal access to resources. Anxiety, stress, depression, they're all rational, normal responses to repeated discrimination, microaggressions, and struggles to meet basic needs. She has several years of working in aging and end of life care, and she's passionate about sharing what she's learned. I loved talking with Caylin today because we have a lot of the same approaches to therapy. And Caylin also specializes in chronic illness and infertility issues. So if you are a resident of Georgia and you're struggling with either of those things, definitely check out Caylin and the work that she's doing. All right, here's our interview. I'm so excited to talk to you. So the concepts that we are going to talk about today, we've talked about some of these concepts before on the podcast, but I think you're just going to have a different perspective to bring along to it, which is really all what this podcast is about. Like hearing the same thing from several different people in several different ways just helps us obtain the information. So,
Yes.
you and I met months and months ago. You had questions about POTS. And
Yes.
POTS is something that comes along with so many different types of conditions, everything from autoimmune diseases to Ehlers-Danlos syndrome to Lyme disease. So it really is a really interesting um, disorder. And you and I were kind of just talking about is this concept of clients not being believed and how
Yes.
that alone changes their life. So I'm
Mhm.
curious, yeah, can you kind of just start with some of your thoughts on that?
Yeah, yeah, absolutely. And this is something that, I feel like as clinicians, sometimes our caseloads kind of go through these ebbs and flows where we're seeing a lot of a certain issue. And I feel like I'm in a season of POTS right now with a lot of my people. And um, the not being believed aspect, I think, is one of the kind of universal through lines I see with my people. Just for many of them, it's like, okay, they've seen several providers before anyone even told them, okay, maybe we're looking at POTS here, and then suddenly you have to become kind of a subject matter expert on what does that actually mean, right? But for so many people, it's been providers telling them there's nothing wrong with them, or, oh, you're too stressed out, just manage your stress level. Like, how can any of us do that right now? Um, yeah, yeah, and so just the idea too, for many of them just having to really put on that self-advocacy hat suddenly when they haven't had to kind of almost make their case to, maybe their partner or their parents or their family members or employers, whoever, okay, this is a real thing. This is not in my head. This is a real thing that I'm dealing with. And yeah, kind of no end in sight here. This is chronic means chronic, right?
Yeah. 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 There's no, people will always want those concrete answers. How long does this last? How do we treat this to make it go away?
Mhm.
And it's reasonable to want things that are hard to go away, but what happens in your life when it doesn't go away? You're the one experiencing it, and so you really have no choice but to accept it. Like even if you fight it really hard, eventually you come to acceptance because you're living with it every single day. There's literally just no other option.
Yeah.
So, but the people around you don't have to live with it. Like they don't
Mhm.
experience it in their body. And it's very easy for them to deny it on a daily basis, especially the longer it goes on, which
Yes.
the longer it goes on, we need more support, not less,
Mhm.
but it's usually quite the opposite.
Yes. Yes, and I think that a thing seems to happen with a lot of different things, but chronic illness in particular, where sometimes it feels like the people in our lives, if we're the one dealing with the illness most directly, the people in our lives kind of hit a wall with how much support that they can offer, right? I do a lot of grief work, and a very similar thing happens too when we lose someone. Most of us experience a lot of support right at the very beginning. People bringing meals or, offering to help with, I don't know, the dry cleaning, mowing the lawn, whatever, taking the kids to soccer, kind of all the instrumental stuff. And then as time goes on, people kind of fade into the background. They feel like, okay, I've, done my good deed, cross that off my list. Or maybe they don't realize, okay, yeah, this person is still dealing with all this, whether it's a death or a chronic illness, right? I think a lot of times, yeah, I've heard people say things kind of like they're even the people closest to them don't even really recognize every day this is here in some capacity, whether it's POTS or another condition, and so usually it is easier to just say, oh, yeah, I'm fine. I'm doing okay today, rather than just saying, yes, today is not an easy day either. And last week was not. And next week will not be either. It's,
Yeah.
mhm.
Yeah. What are some of the themes you see show up then with the client and not eliciting help? What are maybe some of the reasons why and what that
Yeah.
looks like? And yeah.
hmm So I think, I was about to say, I feel like a lot of people with chronic illness can be very kind of conscientious people because we have to go into that mode of paying attention and caring for ourselves. I mean, this is kind of best case scenario, right? Um, and, in terms of asking for help, I feel like one thing I hear a lot is I don't want to burden the people in my life. There's nothing they can do. So what's the point in speaking up? And so I think for a lot of people, it really is about that reframe of, okay, maybe we are not telling people with the intention of them doing something about it, right? If I have a chronic illness, I mean, there's no one in my life who can take that from me, unfortunately, you know? And also, too, maybe that's not the point. Maybe the point is to just not be alone in, you know?
Yeah. Yeah. What are some ways that people on the family member side can
Yeah.
help people not feel alone in it? What are some
Yeah, yeah, yeah. Mhm. Um, so, I would say this with grief work. I also work in adoption. And so, very similar parallels here to the chronic illness aspect. Assume that, okay, so if you're the family member or friend of someone with a chronic illness, assume that it is on their mind daily in some form or fashion, whether they're telling you or not. So I would say the same about, the person, if it's a grief client, the person who was lost, right? Assume that they're thinking about them, whether they mention it or not. Adoption, assume that they're thinking about their first family here and there, whether they mention it or not, you know. So for supporting a client with chronic illness, or a friend or family member with chronic illness, anticipating needs goes a long way. You don't have to do this perfectly, but even just saying, "Hey, I noticed, maybe you seem a little bit kinda tired today. I swung by the store and picked up some things that I know you like, just so it's here." You know? Um, yeah, yes, don't wait for them to ask you because I can tell you, I mean, people don't ask. People don't
Yeah.
ask for any different reasons, but people tend not to.
Yeah, yeah. We don't
Mhm.
even know what's safe to ask for a lot.
Yes. Yes.
And
Yes.
safe, looks so different. Like, and this is where some of the individual work comes
Mhm.
in play. But if it feels unsafe to be told no for whatever reason, right?
Mhm.
Then you're never going to ask for anything because it's unsafe to hear a very possible answer.
Yes.
So then we work with the individual around that and you know, yeah, any thoughts come up for you around that? Just like the inability to hear no and how to navigating that.
Oh, for sure. You may know more about this than I do, but I just anecdotally, I feel like I see a strong link between trauma of some sort and chronic illness. And I don't know if that's the physiology, the stress response, and all of that that's playing a role, or just the fact that we all have trauma. And maybe that's what I'm seeing here. But just, with what you said, Destiny, just the idea about not being able to say no or not being able to be told no, I think that kind of shows up both ways in chronic illness. But I think a lot of people have this kind of core belief that we are least deserving or worthy of attention and care when we have to ask for it. Like this idea of if I'm worth anything, then the people in my life should be kind of voluntarily like checking up on me, taking care of me. I shouldn't have to ask, or
I
I'm stepping out of line by asking.
Yeah, that's a huge
Yeah.
one. Yeah, that
Mhm.
it's less meaningful. That shows up in every type of relationship kind of
Yeah.
scenario, like, even just normal old couples counseling and stuff. It's,
Yep.
I shouldn't have to ask because they should know this is my favorite flower, this is my favorite whatever. Um, and yeah, can you say more about that? Like what? Yeah, it's just like say more about that.
I think, I mean, just, I'm just thinking from kind of classic attachment perspective, I think it does touch that nerve of, okay, am I seen? Am I deeply known? Am I affirmed by this person? Right? Whether it's kind of run the mill relationship issues, or dealing with a chronic illness too. Okay, is this person attending to me close enough to know that I'm not me right now and to know what I need and to want to help me, support me, kind of take the reins right now while I'm down for the count without me asking?
Yeah, and it's interesting when you grow up with parents who do attune to you or caregivers who attune to you, you learn more about what your needs are. And it might even still be hard for you later on in life to hear to be with maybe like a new partner or someone who isn't able to give you that same level of attunement. But if there wasn't a traumatic experience around lack of attunement as a kid, it's not going to feel traumatic within your partnership. So it still might be hard to like teach your partner or your friends or your family like what you need, but it will just be hard. It won't be traumatic, right? It won't feel like it's like a huge wall of I can't like they have to know without me telling them or else it's meaningless. And
Mhm.
it doesn't have to be that big when we start to kind of heal some of those relational traumas.
Yes. Yes. Just I love that distinction. Just the idea of, okay, this is kind of a hard and maybe kind of sucky part of partnership, is, teaching people how to love, like love as a verb, love us in a way that feels right to our system versus like, oh my God, I feel my entire sense of self disintegrating because there's this moment of misattunement or rupture, right?
Yeah.
Yeah, very, very different things.
Yes. Yeah, and then, within chronic illness, and well, going back to like hearing no, it does have to do it's the same concept of like this relational trauma. If you were told no a lot as a child and it was simply from a place of like, we don't have time to like all your silly little requests, right? Or maybe it was much bigger and it was if you asked for something that was an inconvenience, now you were being abused verbally, emotionally, like it can range from really, really traumatic experiences to not traumatic experiences, but maybe just like things that should have happened didn't quite happen, like to be attuned
Mhm.
to. And so if hearing no is really hard for you or saying no is really hard for you, it likely is a trauma response in that you're remembering what it was like as a child to hear no. And that was too unsafe, too uncomfortable without any support. I think when we start to talk about like trauma and how you were raised and attachment stuff, it just sounds like parents are supposed to be these like perfect human beings. And that's definitely not it. Um,
No. Oh, no.
Figure out the support that you have, like when something hard happens. And lack of support means you go into that shutdown mode and you don't try again. Right.
Yeah. Yeah. No, I think that's just such an important point, just really quick. Just the expectation is never perfection, whether a parent or a partner or whatever the relationship is. If that's our expectation, we're setting ourselves up and each other for failure 100% of the time, right? Just that idea of good enough parenting, good enough partnering, I think is not talked about a lot. But that's, I think just thinking about what I hear people say more often is, okay, yeah, maybe they didn't support me perfectly, after this ER visit, say, depending on chronic illness. And the fact that they tried meant so much to me.
Right.
I think it's the effort and the willingness to try something new, as opposed to feeling like we have to have all the answers for how to support the people in our lives?
Yeah, no, I've had several clients who've had hospital experiences where
Mhm.
there was a doctor who, like, they still left with no answers, which is common to have happen. But
Yes.
there was just one doctor who actually talked to them like they were a human.
Mm.
They don't leave that interaction feeling so hopeless and distraught and like the whole system is out to get them.
Yes.
They leave that interaction where nobody took them seriously, nobody listened to them. Like, it literally feels like this system is so, so fucked up and,
Yes.
it's traumatic.
Mhm.
And our
Yes.
system is fucked up, but
Yeah.
it's
It just
So much
takes
more.
one person who can support you through that fucked up system to let you leave without feeling traumatized.
Yes, 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 yes. There is a book on medical trauma that is over on my shelves here somewhere. But I don't recall the title, but it is talking about how and you may already know this, there's just different levels of medical trauma. We hear that and we think something like, okay, a heart attack or a surgery with a complication. But they're talking about how kind of like this, I think it's like level one, kind of lower level, just routine doctor's visits where we don't feel like we're seen as a person. They're talking about how patients come into a medical setting decontextualized, right? We come in as a set of symptoms, right? Not asked about who we are, what we care about, who's in our circle, what brought us here. We're seen as a set of symptoms, decontextualized in this very like kind of artificial, sterile setting, right? And the provider comes in very contextualized, doing things to us, saying things to us that make sense within that one specific context. Shots are a good example, right? You're hurting someone to prevent something worse, right? That doesn't always happen in day to day life. And just that mismatch can create a traumatic experience for the patient.
Yeah, yeah. No, that point, I don't know if you were saying exactly this, but what comes
Mhm.
to is they are doing something within their own context. Like
Yes.
they know all of the context that
Mhm.
the shot is being given in, why they're doing what they're doing. They know all that.
Yes.
So for them, it just makes perfect sense. We don't know any of it. We don't know.
Yes.
It's interesting, right? Because they hate when we come in with our own like medical Googling,
Yes. Yes.
but yet they don't want to. And I shouldn't say it like that, that they don't want to. Our system is just messed up. But
Mhm.
there isn't enough time for them to provide education. And that education, that relational piece is what prevents trauma.
Yes.
That's what prevents medical trauma.
Yes. 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 I think so 100%. Just, hearing what you're saying about, okay, yeah, maybe nothing changes in terms of the answers I have, the way I feel, my treatment plan, none of that, but to be looked in the eyes by a provider who says, I'm sorry you're going through this and means it, who asked me about my life outside of my illness. Like, I mean, that goes such a long way.
Yeah.
You know, it's a
Yeah.
connection.
I gave a talk at a community mental health integrative, not integrative, but well, yeah, integrative. They have like mental health and doctors, and it's like a community center here in Georgia. And one of the tips I said was like to ask open-ended questions. And the person who was hosting for me, she was like, "Yeah, our doctors are. That's probably not a great like. They're a little bit scared of the open-ended questions." And I was like, I mean, I don't remember exactly how I responded within the talk I was giving, but my
Mhm.
thought was like, this is the problem. Like
Yes.
how do you know how to help somebody without asking open-ended questions? And I hear doctors complain often about how they'll say patients are horrible historians, meaning we don't give a whole lot of information on our intake forms and that we are just, we leave a lot of important information out. But again, we don't have the knowledge to know what's important to tell you and what's not. And all we do know is that when we do talk too much, you don't have time for it.
Right. 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 Yes. Yes. Or maybe get labeled as difficult in some way. Or, I mean, my goodness. And I think that is really, kind of a shattering thing to hear. Just the idea of open-ended questions are not dealt with. I mean, I feel like anecdotally I've heard that, but even just hearing that way, my goodness, but I think how could we distill an entire human being down into just like, okay, have you had this in your history? Yes, this, no, it's, oh my gosh, no wonder.
I know. I know.
Oh,
And
yes.
it's hard. I mean, it's not easy for anyone, the doctors, the patient, but
Wow.
what we
Mhm.
do know is that all of these things that are hard are contributing to like less and less collaboration, more and more mismatch between provider and patient.
Yes.
And especially with something that's really misunderstood, like POTS or
Mhm.
even just like IBS. Like
Yeah.
no one really talks about IBS, or people talk about IBS as like this disease in and of itself. Like you have IBS. And it's like, really, this is just it's a combination of symptoms
Mhm.
that ebb and flow.
Mhm.
I think that's the hardest part for doctors is when they have stuff that ebbs and flows and it isn't in a straight linear line, which I don't
Mhm.
understand because the body doesn't work like that.
Right, right, right. And what works for you at one stage of your life may be different as you age because our bodies change, you know. This is something I stumbled on recently. Definitely not new in this sphere as an idea, but just the idea of learning your personal triggers, right, for your symptoms, what they are right now, without shaming or blaming yourself. Because I can't tell you how many times I've heard someone say something like, "Oh yeah, I had a flare, but I did it to myself because I don't know, ate cake at a birthday party." No,
Oh
you
yeah.
did not do this to yourself. You made a choice. Yes, maybe things happen. And quality of life is so important. Like you're not suddenly this like very militant, like almost like prison warden, right? For your body. Like you're allowed to make these choices and these calculated risks, you know?
Not to mention one choice doesn't
Mm.
cause a flare up.
Mm.
Like one small thing, like flare ups happen because of it's just like people know about like MCAS, mast cell activation syndrome. We talked about this on another podcast of like the bucket theory, and it's really common within MCAS, but it's actually true for everything, mental illness, just being stressed. Like the more your bucket is filled up with something. So we know sugar is inflammatory, fine, but it's not inflammation in and of itself is not dangerous. Our body actually gets inflamed every time that we put food into our mouth, whether it's sugar or broccoli. But how much you're eating or and then what else is going on in your life. If your stress levels are like really super low and you eat some sugar filled cake, there's going to be nothing that comes of that. Like you're going to be fine. But if you have stress and you've been eating cake all day and you've been like, all of that starts to build up. And then, sure, maybe a flare up happened. But even still, with proper support, like from your community, from your doctors, like emotional support, physical help in the house, picking the kids up from school, like having a carpool that where you take turns and that's a source of support, a daycare that you really trust, like all of these things are supportive practices that can be in your life. The more support you have in your life, the less of a stress response your body will give to certain things. So a piece of cake might throw you over the edge one weekend, and 2 months from now, it might not even do a single thing to you wouldn't even, your body doesn't even know you just ate cake. Like,
Mm.
so it's not about then figuring out the exact thing. It's actually about like letting go of what the
Mm.
exact thing is because we don't really ever know. You can't know what's in your bucket all the time. Like it can literally be there's just so much that's unseen that we don't know that goes into our bucket. So,
Mhm.
therapy, we focus on not necessarily like taking as much out of the bucket as possible, but on building a bigger bucket, like creating a bigger bucket, which means adding more resources into your life, calling on people for help who you trust, um, learning coping skills and building, internal resources as well, the part of it, but it's definitely not the end all be all. It's not up to you to have the right mindset and be super positive all the time. And if you are, then that means you'll have this big bucket and you can handle anything. It's so complex and layered.
Yeah. Such a good way. I mean, just a good reframe that I'm going to have to kind of file away to keep in mind too with my people. Just, it's as you're saying that, I don't know if this is exactly a one-to-one analogy, but I thought of, I live here in Georgia too. We know about tornadoes and all of this stuff, and you have to have the right conditions for a tornado to happen, right? Um, Having one of them is not gonna do it, right? So think about that with that's the piece of cake, right? Maybe sometimes that will be the thing to do it, maybe not, it just depends on everything else, and I'm a social worker, so thinking systemically, I'm like, I love what you said about, okay, but actually the community care aspect too, that could be, another piece of this equation too, how supported are you? Or are you feeling burned out and doing everything yourself as your baseline, you know?
Yeah. Yeah, absolutely. Yeah. And it's hard when we live in a society that really values doing everything yourself. Because when you have a chronic illness that it's actually not healthy for anyone, but when you have a chronic illness, it's just even worse. It's even harder.
Yeah.
Um, and it causes so many more problems. So a part of my work with clients often revolves around building a support system. So it still takes on a lot of that language around personal responsibility, which is that individualistic approach. But the we have to meet ourselves where we're at as well.
Mhm.
And we live in an individualistic society. So there is a part of us that has to, again, like, meet yourself there, take on some of that individual approach in an effort to figure out how to build a systemic a community that feels like it can support your individual efforts.
Mhm. Yeah. And, I mean, even just reframing how you think about individual efforts, though, too. It's like I might not be able to keep my whole house clean, say, depending on how I'm feeling. And it is within my control, right? To be able to answer honestly when a friend who I know would help me asks how I'm doing, right? If I have the resources, it is within my control to outsource that help, right? Which is to a service, which is totally fine as long as you're treating people with respect and compensating them fairly, morally neutral.
Yes. Yeah.
Yes.
Exactly. I know. I
Mhm.
I just struggled with that. I finally hired house
Yeah,
cleaners.
yeah,
I was gonna say it like I did.
yeah,
So
morally
much
neutral.
yeah, and so much shame
Mhm.
around it despite the fact that I do this
Mhm.
stuff for a living, work on shame and, you know, which just shows how human it is. Like, it's not
Awesome.
that we wanna live our lives in a way that we never once feel shame or discomfort about our decisions, but it's more, okay, can you feel that feeling and then figure out if that feeling is like, is it a sign that you've done something wrong, or is it just like a habitual pattern of how you were raised, and can you kind of feel it and let it go? Feel it and let it go.
Yeah, let it go. Yes, I think it's Marsha Linehan who was saying kind of like that reality check when you notice shame bubble up. Is this realistic for the situation, right? Because there might be some situations where, um, what do you think? Am I comfortable? Yes, I am comfortable saying this. I am in recovery for an eating disorder. I have been symptom free for decades, actually, at this point. And I'm so happy about that. And as a professional, I am very aware, that may not be heard super kindly in all parts of our field, right?
Totally.
Yes,
But
yes,
I love that our field is really turning towards like lived
yes,
experience being so
yeah,
important. But there's still a lot of folks who are like, why would you say that out loud? And it's just terrible.
yes, 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 yes. And I'm at a point in my healing, because I feel like we never stop, where I recognize that the shame that I might feel in those moments is not mine, right? And what does that mean though? That still means I don't tell everybody, I don't shout from the rooftops about this, right? And also, I start fighting the system now, the system that perpetuates the shame, not myself, not other individuals, but the system that says this is taboo to say as a therapist,
Yeah, exactly.
Yeah.
Which is a big part of what this podcast is about. Like, it's why I interview therapists, and it's why the format is the way it is, because so many of us have lived experience and clients need to know that.
Yeah.
That's how we demystify this process for people. So, yeah, gone are there days where, you're a blank slate, and there's, it's not that you just overshare about your life in therapy. Like, you
Right.
definitely, you keep the focus on your client. You think about how what you're saying about yourself is going to impact the client, and then you make a very educated decision about
Yeah.
it.
Yes.
But it's not about like, there is no like morally right, like, oh, don't say anything about yourself and don't let them know X, Y, and Z because what? I don't even know. I
Yes.
guess, well, it's interesting, right? This comes from the days of Freud when
Mhm.
I think there was a thought that if I say this thing out loud, it will influence you.
Mhm.
And as a white male with a lot of women on his couch, of course he was going to be influential because white men held all the power.
Yes.
As that dynamic is starting to change in our society, I think that's where this shift is coming from. It's like, wait, I can actually have a conversation with a client and I can say something, and then we can talk about how it impacts them. rather than like pretending that my word is so all powerful that if I say this thing, you are going to be so influenced. And therefore, it is now dangerous for me to give you any part of who I am.
Yes, 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 absolutely. And I do think I agree with you that there is this more of a push toward authenticity from the standpoint of the therapist. My stance with clients is they can ask me what they want to ask me. If I'm not comfortable sharing for whatever reason, I won't, right? But if you ask, yes, I likely will answer and expect that we'll do kind of the usual therapy processing questions of, is there an answer you're hoping for? What does this mean for us? Right. What brought up this question right now? And not in a hot seat kind of way, but just so we can kind of recenter it and keep it right sized. I would never want information about my life that a client finds out one way or another to become so large,
Yeah.
in their mind that contaminates our relationship.
Yeah, absolutely.
Yeah.
So, do you feel comfortable talking about any of the health stuff that you have experienced?
Uh, sure. I'll let you know. Yeah, it depends on what it is.
Also,
Um,
you mentioned having like some symptoms, and I was actually curious if you wanted to talk a little bit about that because there are so many. That's really what started my work in this was like
yeah.
people who don't have a diagnosis
Mm,
or
yes.
experience these weird random things, and there's guilt. Like, I did this wrong, I did that wrong, and so that's kind of my thinking.
Yes. Yes. Okay. So how about this angle? I'll talk about kind of the effects of what I deal with without saying specific
Sure.
diagnoses or labels. Is that okay?
Yeah, that's perfect. Yeah.
Okay. Yeah.
Yeah. So, what are you comfortable sharing with us about those experiences?
Yeah. Yeah. I would say for me, probably the biggest thing that I notice is my energy level. I mean, for a variety of reasons, some physical, some related to my own personal history. My energy level will fluctuate wildly. Um, I will have days where I'm like, I am doing all the things, right? And what happens is I overshoot. If I kind of catch a wave of having energy and engagement in my life, it's been a skill to learn to not burn through all of that energy just because I can. And I don't know when I can count on feeling that way again, right? Because that is a surefire way to make sure that I end up in bed the next 2 days, right? Um, and
And
just kind of oh, I'm sorry?
I was just gonna say, like, within that though, because this is a really common thing that I
Yeah.
work and within
Mhm.
that, there can still be this narrative of like, yeah, I overdid it. I overshot.
Mhm.
And so therefore now I'm in bed for 2 days. But also as cis women, we have a menstrual
Mhm.
cycle and our hormones
Yes,
fluctuate 28 day. There are 4 different parts of your cycle, right?
yes.
What you can do during your ovulation phase is typically, generally speaking, going to be so much more than what you can do during your menstruating phase.
Mm.
And so if you don't know,
Reminder.
if you don't know that, then you blame yourself. Like I overdid it. But what if like your concept of how much you could get done today was based off 2 weeks ago when you were ovulating and you thought you could
Yeah.
get done? But your body
Mm.
is like, "No, I'm feeling weak and tired." And you don't have to know exactly where you're at in your cycle to be able to know that. The more you learn to listen to your body, you're able to figure out how tired you are in a given day, regardless of the reason, whether it's your cycle or you didn't sleep well last night or, whatever the reason. It truly like the more in tune you get with your body, the less it matters, which
Mhm.
that's what we were talking about earlier about the bucket. Like it's just being in tune with what's happening for yourself. But yeah, there's so much we don't know, and then we blame ourselves about how we contributed to this, and it's like, well, again, like, what other factors are at play here?
Mm. Yes. That is such a good reminder, and I do appreciate that because, oh my gosh, like, the things we say as therapists that are meant to be helpful that actually are not sometimes, right? I'm sure you've had those moments too where you're like, "Oh gosh." Yes, I know. All the time I have them, right? But the whole compare yourself to yourself thing, I think is often helpful, right? But even just with what you're just saying, I had that light bulb moment of, oh, but also too, maybe that is, making, it's like, oh, if 2 weeks ago I was great and now I feel like I'm just like a puddle of whatever lying on the floor of my room. It's like, okay, well, that is a shame trigger too, maybe, right?
Yes.
Yeah.
Yeah, and just to add to that, your body uses the every other ovary every month. So that's why people be like, I don't know, it's all over the place. One period I have all these cramps and the next I don't. And my energy is out like, and there's no pattern. And actually, if you track your symptoms for 4 months straight in accordance with your cycle, if you have a 28-day-ish normal cycle,
Mhm.
then you will find patterns. It just isn't every month it looks like this. It's like every other month it looks like this. So when we aren't taught this stuff, like, in sex ed, like we should be, in class, like we should be, God forbid, like,
Yeah.
bodies.
Yeah.
uh, And so,
Yeah.
and you aren't educated properly on your body,
Mhm.
it contributes to this.
As I'm editing this podcast, I actually came into new information about this. There's a really good book called Blood by Dr. Jen Gunter, who explains that it's actually not even every other month that our bodies use it, like 1 month and then the next month and the next. It's kind of more random. So it could be like 2 or 3 months in a row, one ovary is used, etc. So there's really no pattern, which is probably another reason why sometimes our symptoms can fluctuate so much.
Yeah. Especially when all you hear growing up is like, oh, you're just moody because you're on the rag. It's
Oh,
insulting,
God.
so inaccurate. It's like, well, actually, I can handle less stimuli because I'm on my period. I am physically weaker when I'm on my period and therefore need more support in this area. And with the proper community around me who just supports one another, that's a non-issue.
Mhm.
But
Yeah.
you're supposed to pull yourself up by your bootstraps every single day by yourself without help.
Gosh.
Well, of course, we're all chronically ill. Like,
Yes. Yes, yes, yes. And I think honestly, one thing that I've noticed too, just in my work with clients, I've been kind of dipping into compassion focused therapy. I would say ACT is probably my like but that lens, I feel like just the whole idea of learning about how our brains work and the gross mismatch between our brain functioning and the things that we've evolved to do relative to modern society. That's where so much of our distress comes from. Like, even what you're just saying about this idea of, okay, well, maybe we won't notice these fluctuations as much in our ability and kind of our temperament and everything like that when we're like kind of living more collectively and there are other people to kind of step in and when other people need to tap out. We don't live like that, generally speaking, these days. And gosh, no wonder the individual feels like they're the ones with the problem. No, it's just that mismatch, you know?
yeah. Yeah. And, I'm reading this book called The Power of Discord. It's really good.
Mhm.
And it's about a lot of this, like mismatch and repair. And it talks a little bit about, actually, it might be this book or a different book I'm reading on play therapy, but it talks about how play inevitably allows for mismatch and repair in a really natural, organic way. And so before
Mhm.
we hit record, you were talking about how you work with kids, you do
Yeah.
you play-based interventions with your
Yeah.
kids, and you would love to more with your adults, but they're often resistant.
Right.
And I talked about my own experience. I'm very resistant to like moving and play and all of that. And it's something that having a kid is really that has been the impetus for me to learn how to do this because I want to be able to not have so much mismatch with her.
Yeah.
Um, but yeah, so maybe you can talk a little bit there about like play-based interventions and when it works with adults and what that looks like when it is working.
Yeah. I would say play with adults in a clinical setting for me would usually look kind of like sand or art or maybe kind of some experiential kind of stuff. It's not necessarily kind of like what I would do with my younger clients, where we're kind of just like rolling on the ground and being silly. And now we're, playing basketball and now we're playing with my little toy kitchen. Obviously it's not going to look like that. But I think one of the big barriers is that I feel like as adults, a lot of times we are very much in kind of left brain mode because that's what our society values in most situations, right? Is kind of logic and okay, I can present this coherent story about my crisis of the week and you tell me what to do and I leave feeling like I have some actionable takeaways. And we really, I feel like under rely on kind of the experience of being together And, I think about some of my most powerful sessions that I've had with even my adult clients. And I think it's often the case that very little was said. When I think back on it, we sat together, we breathed together, and the presence was the medicine in that moment. And I'm not saying like, medicine is medicine. The presence was what was needed in that moment, not the verbal stuff, and I think that just the idea of play and movement and kind of these more experiential modalities, that's kind of a trapdoor to that feeling too, that felt sense of corrective learning, maybe about connection and relational safety and things like that. And I feel like adults, we just feel like we got to talk. And as the therapist, sometimes I feel pressure to kind of be like, okay, and I need to have an answer for you when sometimes I don't have one.
Yeah, no, absolutely. I definitely have had that pressure less and less since it's my own therapist does roll around with
Really?
adult clients, and she has a training program and everything for therapists.
Love
I
it.
just I have spent my whole life looking for a therapist like her. So I just talk about her pretty much every chance I get.
Yeah.
But,
That sounds
yeah,
wonderful.
she had like a studio in her office. There's space to do that. It's like a small yoga studio kind of
Yeah.
thing.
Oh,
Um,
wonderful.
yeah, and she does. She moves, like she gets up and she dances and she moves and you know, um yeah, so she's great, but it even though I trust her implicitly, my body still goes into like it I feel like I'm probably one of her more resistant clients. Even even though I love the work so much, because logically, I've read all there is to read about it. I know how beneficial it is, but again, like our society, very left brain.
Yeah.
So I still feel safer in my intellectualism. And I'm
Mhm.
trying to move more. I definitely am moving more. In fact, bringing my child with me to therapy is what helps me move more in our sessions.
Wow.
Yeah,
I think it's a really powerful experience, really
it's
for all of you.
it is. Yeah, it's just something you can't really put into words, which is the whole point of it. Like getting
Yes.
your out of your head and into your body.
Yes.
Uh, and mismatch and repair. Like I'm going to do a whole podcast episode on this regarding like chronic illness and mismatching. But every
Mhm.
day when you're living with physical health symptoms, there's a mismatch happening. So then we have to figure out how to repair, and play is what helps you figure out how to repair.
Yep.
Sure, we can write a list of self-care practices like drink your water and do the things that repair like a hard day, you ate too much whatever and now you don't feel good. So please like drink some water, get some vegetables in your body, like do support your body in that way,
Mhm.
but it's not about a list. Like because there's still a lot of reason, like I said, like I still go into therapy and there's still a lot of resistance to moving my body, even though I know that that is what's most healing. But it takes practice. Like mismatch and repair means, okay, I want to trust you, but I don't yet. So through play, I'm going to learn how to trust you, but that requires that experience. Like there's no I
Mhm.
can read everything in the world, and it's not going to make my brain just like jump into this without fear.
Yeah, absolutely. And, this is resonating with me so strongly right now because I'm in process of being trained in Theraplay. I don't know how much you know about that as a model. It is great for young kids and it is great for kids. Gosh, you could probably even do with adults, too, but like with complex trauma histories who didn't necessarily get those that. So if you think about kind of the attachment dance with a young baby, kind of, oh, they coo and ah, and you wave your hands back at them, they make a face, you make a different one back, right? And it's that feeling of being seen, noticed, affirmed, reflected back to yourself, and that it's that serve and return, right? And so Theraplay really kind of scales up that same dynamic through different interventions, and it is very experiential. It is the parent or the caregiver is involved there with the child, and the therapist mainly in time, the role is to kind of create the conditions for them to do the therapy interventions together. That, ideally, the therapist will move to more toward kind of just a facilitator role rather than being directly involved. Um, but it repeats that kind of reciprocal dynamic, just a very, very, just beautiful model, but it is also very brain-based and evidence-based too. It's strengthening, that brainstem platform and the limbic system and all this stuff and giving those reparative experiences to people who didn't necessarily have them when they were babies, right? Um, and I can see how it's just that's everything. You don't process your interventions after you do them, which to me is so like not what I'm used to, right?
We're taught,
Yeah.
debrief. How did that go? And
Yes.
yeah,
Yes.
no,
Yeah.
yeah, exactly. Like it's learning how to dance. It's
Yeah.
learning how to dance. And when you are learning how to dance, not that I have any experience this, because
Uh,
I don't, and I don't do. But when you're dancing, there's a lot of missteps, right? Like you don't just like watch a choreographed dance and then go and do it. Like you
right.
have to mess up. So that's really what a lot of this is about, even with your body. Like you have to, we were talking earlier about like, if I messed up, now I'm in a flare for 2 days and it's my fault. And it's like, well, actually messing up was a part of this. So one, it's likely that like it wasn't your fault to begin with. There's so many factors that aren't within our control.
Yeah.
You did do something that was bad for your body and it did cause a flare up. And that was a misstep with yourself. Okay. All right. That's fine. That's a part of this process. And when we learn how to do some of these experiential things and we dance with it, the misstep, the
Yeah.
thing that caused the negative thing to happen doesn't feel like you're not suffering over it. It's just like, oh shit, like this was what happened.
Right. Right. Yeah. And it's so funny. I think it's such a cliche too, but just the idea about how sometimes therapists are the worst at kind of taking the things that we say to clients to heart, right? But I feel like 100 times a day, sometimes it feels like I'm saying, oh, ruptures are inevitable in any close relationship dynamic is part of the process. The repair is the important thing. We don't do that to ourselves. We don't apply that lens to ourselves, and just this idea of what you just said about, oh my gosh, maybe this is just part of it. And how do I repair with myself, have that compassionate attitude of, oh, sweetheart, it's okay. This happens. Oh, you can feel bummed about this and it'll pass,
Yeah. Yeah. I mean,
Yeah.
because again, like it's not about the knowledge, it's about the practices. Are you reflecting when you made a mistake? Are you reflecting and repairing? Like, are you actually doing that work? Or are you just thinking, yeah, is it all in your head? Like, are you just thinking about this stuff? Like,
Yeah.
it requires action. And if you don't have support to help you with that action, then you're not going to do it. Right.
Right.
And therapists, a lot of times we don't have that support.
Yeah.
Like we have this like 2 to 3 year process where we're getting licensed and we're supposed to have support. But in all honesty, a lot of times it just looks like here's the right and wrong way to do things, which is bullshit.
Uh-huh.
Is no right and wrong way. And there's
Yeah.
ethics. There's things you
Right.
should never do with a client, but
Right.
there really is no right and wrong way to do therapy. So there's not a lot of support in this field. You have to really be intentional. It's just not built in. You can
Yeah.
find ways to build your community and get support, consult groups and mentors and things like that. But you kind of almost have to have the resources to begin with.
Yep.
Do that. So it's just very layered.
Very, very layered. And I remember I was having this conversation with someone the other day, but I remember they always told us, like, okay, it's going to be really difficult and suck until you're fully licensed. And then that's when, you'll have a lot of opportunities open up, you'll be compensated well. And oh my gosh, like people are burning out before they even get to that point. And, and just I'm talking about ethics, I really believe this. If you see people in the field who are consistently acting unethically, right? Lapses in judgment happen, but consistently acting unethically, trace it back far enough and there's a broken system. I think individuals don't get into this field wanting to be like kind of bad actors, right?
No,
Even
they're
though
not trying to hurt anybody. They're just
no. We're, I think by and large, as you said, with exceptions, but we're not supported by our profession. We are expected to leave whatever we're dealing with at the door. And it's just not possible. We're humans,
yeah.
Yeah.
Yeah, they tell us to leave it at the door, but you can only leave it at the door like correctly if there's someone to hold it for you.
Yes. Oh, great way to say that. Yes.
Of course, you don't bring it into the session with your client, but in order to do that and compartmentalize in a really way that's
Mhm.
healthy for both you and the client, you need support with that. So
Absolutely.
there's
Yeah.
ways to do that. We're definitely not trying to say that it's hopeless in our field. I'm just saying it's not automatically built in.
Mm-mm.
And a lot of this kind of conversation to make you aware that this is what you even need. Because I think I mean, I see so many comments on Facebook, like by other therapists and these therapist groups on it, and I'm like, where's like you would not be asking that question on Facebook if you had the right support system. Like,
Yeah.
where is your support system? And you probably don't even know that is what you need.
Yes. Yes. And this is the thing that makes me so sad is how often you see these questions asked anonymously. And that person sometimes even says, like, I'm doing this anonymously because I know this is not a good question to be. I'm like, oh my gosh. Like, what? Like, this is the
Yep,
system, you know?
exactly. Yeah, yeah.
Mm.
We're not allowed to mismatch, right? Like people are gonna have questions that maybe are a little bit, ooh, like that's
Sure.
why are you even thinking that? But if
Sure.
you have the right support system, they take that as a mismatch and then repair. Mismatch.
Yes.
So again, like we're talking about our field right now, but it's a societal issue. And so
Yes.
60% of this country has at least one chronic condition. More than half of our country is affected by chronic illness.
Yes.
So we are all experiencing this. And the system in which we are told you're not allowed to ask questions, or we're told there is no stupid question. You're allowed to ask anything, but then there's support on the other side.
Right.
That's the problem. And so when you live with a chronic illness, of course you don't know how to ask for help. Of course you don't know how to even know what you need, let alone then ask for it.
Yes.
If you've
Yes.
been told no to all of your needs since you were an infant, really.
Mhm. Yes. 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 And I think just thinking about that, kind of focusing back to the chronic illness aspect of it, even myself as a therapist, this has been a huge growth edge for me is learning how I work best with my unique considerations in mind. And that might look like days of the week I see clients, how many clients in a day, and really having to honestly kind of get firm but compassionate with myself about not overstepping my own limits. And that's been hard because sometimes, you look to other colleagues and somehow there's someone who sees 10 clients in a day. And, I have feels about that, but you know, um,
I do not want to be someone's 10th client. That is all I have to say.
no, no. And, just really kind of having that stance of myself of it does not matter. It flat does not matter how many clients anyone else is seeing in a day.
And
It
you know
makes
what else comes to mind
Mhm.
about this? I think
Mhm.
this is so important. When we actually really allow people to have differences in their needs,
Yeah.
like I have a friend who's a therapist and she's a night owl. So like when she first started, her life has changed a little bit now, but like when she first started private practice, she's like, no, I like want the 7 and 8 o'clock clients. I'm dead by 8 o'clock at night. Like, please don't.
Uh-huh.
And and I used to have a lot of shame around that. My friends would all be going out all the time. I wanted to be in bed by 9 o'clock. And night owls have a lot of shame about not being able to get up in the morning.
Yep.
And you'll also hear people say, how do you only work 9 to 2 or 9 to 3? Like people need those afternoon slots. One, a lot has changed with COVID. I'm so fucking thankful for that. A lot of people
Yeah.
are working from home and there's flexibility.
Yes.
Two, there are other therapists who are night owls that are more than happy to see those clients. That is
Yep.
not me. And you don't want me trying to see a client at 7 o'clock at night.
Mhm.
You don't.
Yep.
So
Mhm.
we honor each other's strengths. There's room for everyone to
Mhm.
take responsibility in the needs of the community. So I just think that's really important. It goes back to like with chronic illness, like
Yes.
might not be great at cooking. Your partner might be. Let them do all the cooking. Like let them. Don't feel guilty about that. They
Yep.
love cooking and you don't. Don't try
Yeah.
to force yourself to do something that you don't love doing. Somebody else will pick up the slack and you will pick up the slack where they cannot or don't want to.
Mhm.
So
Mhm.
yeah,
Yeah.
definitely
And
so.
then what yeah, I mean, really, truly though, like and in time, I gotta believe that kinda cosmically, it kinda evens out in the end, if everyone just does what they can when they can, I gotta think things kinda level out, you know?
Exactly. Yep.
Yeah. Yeah. It's interesting. We started with the idea of kind of, hearing no from other people, but, saying no, I think is just such an important part of the chronic illness experience thing too. And kind of really just being comfortable saying, I'm not able to accommodate this, no apologies, no over explanations. I mean, say sorry if you want, but you don't owe anyone,
Yeah, yeah.
but
Be sorry if you've done something wrong. Don't be
yes.
sorry if you just cannot accommodate someone's need that was
Mhm.
never your responsibility to accommodate anyway. Then yeah, we don't need to apologize for that.
Yeah. I've had the experience recently from time to time, not super often, but from time to time of needing to cancel some of my later clients unexpectedly. If I'm not well by the end of the day, and I feel like I'm not going to be able to give of myself what I need to give this person,
Right. And that's
Um,
right. So that's a mismatch
yes,
within yourself, right?
yes,
And not
yes.
to like therapize you, but I'm
Yeah.
just kind of thinking of my own experience too. And like to relate it back to the episode, like we have mismatches and then you
Yes.
repair that, whether that's you don't schedule anymore at that time or you like do something else during your day that like rejuvenates you at that
Mhm,
point in time. Like
mhm.
there's several options. Again, there's no right or wrong, but
Yep.
that's how we work through this stuff is mismatch happened. That's okay.
Mhm.
Pair.
Yes, yes, yes. And I gotta think, with working as a therapist, there's always kind of like a meta lesson that we're teaching clients too. Just what are we modeling, right? And that is a situation. If I'm not well and need to cancel an appointment I have scheduled unexpectedly, right? That's a situation where I'll apologize for the inconvenience. I'm not going to apologize for not scheduling outside of my designated hours, right? That's not something I've done wrong. That's just a choice I've made, right? Get thinking about, oh, are they watching me and seeing the example of someone set boundaries kindly? Are they maybe then internalizing that and learning they can do that too?
Right.
Maybe, hopefully, you know?
Yeah. No, absolutely.
Yeah.
That's a big part of this work too.
Yeah. Mhm.
Um,
Yeah.
is there anything else that feels important about this that you want to leave people with? Anything?
Yeah. That's a good question. I mean, we've kind of dipped in and out of kind of my grief lens that I do see most things through. And I think a lot of what I do is kind of helping clients see that there are certain things that are grievable about their experience, whether it is a death loss or new diagnosis or, some new symptoms that don't have a label for them, um, just the idea of, what used to be is not going to be any longer. And that's grievable, and just validation for everything. I think that's really kind of the big angle I take with that. If something has changed, that's a grief experience, right? And um, it doesn't mean that's all sad. Bodies are funny. They do strange things. They're confusing. They're weird as hell sometimes. And I think being able to see kind of the absurdity and the humor in that, never laughing at someone, but I know for me that's helped a lot too, to kind of just have the stance of, yeah, I don't know what my body is doing today. All right.
Yeah.
That's maybe as far as I've gotten in my own healing, but it works
No,
for
that's plenty
them.
because that's hard enough to even get to that point. But once you do, like, yeah, it's not that the pain
Yeah.
is funny, but it's like the humor is more so about like the responsibility piece. Like, yeah, it's not my like, it's not my fault.
Yeah.
Bodies are weird, and that
Yeah.
that in itself is funny.
Yeah. It's doing its thing. Yes. Yes. For me, I think just laughing where I can has been everything.
Yeah, it's important.
Yeah.
Well, I appreciate your time today. This is
Yes.
great talking to you.
Yes, you too. I love this. So much fun.
Thanks for listening. If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need. And lastly, leaving a review really helps others find this podcast, so please do if you found this episode helpful. And P.S., clicking subscribe ensures you'll be here for the next episode. See you then!